Ancient Chinese medicine suggests that for the body to function properly, it must be in balance. Acupuncture uses the principles of yin and yang to balance the body's cells so that the positive and negative elements are equalized. Now, in the 21st century, combining 5,000 years of traditional Chinese acupuncture with modern preventative medical technology, we have Aculife. An approved Class 2A medical device in Europe and carrying FDA approval in the United States, Aculife is a small, easy-to-use handheld device that can detect and relieve a wide variety of ailments. We will show you how easy Aculife is to use and how effective it is for managing pain. And it's so small and light, it can be tucked into your pocket or handbag when you're on the go. Although primarily designed for use by ordinary people at home, Aculife was also seen by some physiotherapists, complementary medicine practitioners and doctors as a tremendous aid to patient care. The acceptance of Aculife for its pain management qualities has led to enormous media coverage in the press and on both radio and television. On RTE Nationwide, chartered physiotherapist Neville Cohn spoke about Aculife's effectiveness in treating his patients.
Very good results, yeah. We've been documenting them recently enough in the Aculife hospital here. Not enough obviously to go through a full clinical trial yet, but hopefully that will be the plan. And so far so good. Patients have had good results mixed with normal manual physiotherapy techniques, and the pain relief and the benefits seems to have been very good.
And one of his patients, Bernadette Mullally, spoke about how Aculife helped her deal with the pain of a severe neck injury.
3 weeks ago, I couldn't have seen myself walking hardly down the street. I mean, I hadn't had a night's sleep in 3 weeks. I was just asleep on the chair. And actually last night I had almost a full night's sleep. It's just great.
Clinical hypnotherapist and complementary medicine practitioner Kevin Kinahan used Aculife to detect a previously unknown kidney problem.
Now, as far as I was concerned, I hadn't got a problem with my kidneys. But I said, oh wait, I don't know, I can't feel that pain. So I went to a Chinese acupuncturist and he did reflexology and he told me that you have a problem with your kidneys. So that was a sort of confirming this diagnostic. So I knew too, like that, personally I'd be a bit sceptical at the start, but when I get a couple of evidence that it really does do what it says on the label, it finds what's wrong with me.
Dr. David McDermott, an Irish medical doctor, tested Aculife and said, treatment using the device is simple with easy to follow protocols and suggestions provided. In my short time using the device, I was impressed by the accuracy of its diagnostic abilities, the rapid ease of several acute illnesses and its ease of use. The usual rules apply, of course. If in doubt, consult a specialist. And it's always useful to know what you're consulting them for. Porrick Brown, an 80-year-old suffering with severe hip and back pain, tells us about discovering Aculife when the only option appeared to be a serious operation.
But he referred to me to a surgeon in the Mater Hospital, and he explained exactly what the operation entailed and what he would do. And so at that stage I had acquired the Aculife, and like the previous man, the Aculife was working wonders for me. And I said to the second surgeon, can I defer this? Oh, he said, yeah, we have you on the list, and just ring me if you have any problems. So, thanks be to God, I've had no problems. The Aculife is working. Now, it doesn't cure you, but it certainly gives you great relief.
Now, he not only has relief from unbearable pain, even his golf has improved.
Yesterday on my 80th birthday, I suppose I played the best round of golf I've done in about 5 years.
Apart from detecting known or unknown ailments, common problems such as back pain, rheumatism, arthritis and muscular pain can be relieved with regular use. In fact, feedback from Aculife owners tells us that this unique medical device is used daily to effectively treat more than 57 different medical conditions.
Well, it's like any modern telephone. When we got the mobile phone, no one used it, and then now everyone is using it because it's convenient.
Peter McNamara suffered from a severe cartilage problem in his knee. He describes his experience of Aculife to Ireland AM presenters.
I had a problem with my knee. In early June I twisted my knee out playing golf, and I couldn't walk. Basically I was limping. Went to the doctor and I got 2 courses of anti-inflams.
Of course,
and
yeah. That's what the norm, yeah.
Yep, and there was a month on anti-inflams and didn't do anything to it. I was still limping. And then I got referred to a surgeon who said I did need work on my knee, but he was reluctant to go in and do anything because of a lot of wear and tear in it. And he wanted to put me on another course of anti-inflams until Christmas. So I went on one more course, and then my brother-in-law suggested that I try this.
And how did you hear about it? Your brother-in-law just told you about it?
He had used it, and he said, give this a go. And he gave me a lend of his machine for 10 days. And within 10 days, I was limping quite badly, but in 10 days I was walking fairly freely.
Rosemary Flynn suffered problems with her sciatic nerve and a disrupted sleep pattern.
I wasn't sleeping at night. I had a bad pain, I thought, in the sciatic area. That's where I had the pain. And I thought, if I get this, I'll try it and see if it works for me. And I bought the machine within a week or so, and I got great relief. The first night that I used it, I slept the whole night, and that was the first night I had slept in 3 months. And since then I've used it every night, maybe 20 minutes or so before I go to bed, and it takes just 20 minutes to do it. It's a very easy machine to use, and I was just very impressed with it.
Your Aculife unit is delivered with everything ready to go. In the box you will find a hand map which charts all the different organs and muscular skeletal systems of the human body. With this, you can quickly and simply identify points relating to various illnesses and complaints, all in the palm of your hand. You also get the Aculife unit itself, the magnetic wave pointer, a selection of different sized earpieces, an AC adapter, a battery and a clip holder, so you can use it anywhere, anytime. There are 2 ways to use Aculife. One with earpieces that give you the benefit of ear acupuncture as well as hand acupuncture, and the other is with a patch system that attaches to the forearm. So, let's have a look at the first stage of using Aculife, detecting. Detecting couldn't be any easier. First of all, set the machine to detect. Use the plus and minus buttons to set the intensity level which you are comfortable with. Then place the earpiece in your ear or the patch on your arm connecting the other end of the lead in the machine. Then slowly run the blue pointing device over your hand, both back and front, without lifting it from the surface of the skin. When you find specific acupoints in your hand, which generate a strong sensation, simply mark all of these points with a biro or a marker. You can then reference the points of greatest sensation with the hand map to determine the areas of the body represented. Now we can look at relieving the pain or rebalancing your body. Again, this is as simple as detecting. You simply put the Aculife machine in relieve mode and set the power to a level that is comfortable for you. To identify the ailment, refer to the acupoint suggested on the Aculife hand map. You then place the blue pointing device against the points you marked. Hold the blue pointing device on each point for 5 minutes. The timer will count down 5-minute segments for you. It is important that you remain on the point where the strongest sensation is felt, and this may mean moving the probe slightly around the marked points while treating yourself. Repeat this on each of the acupoints that offer relief for your problem, as shown on the hand maps. By following the instructions in the Aculife manual and using it regularly, patients usually find their pain is relieved within 2 to 14 days.
When the machine goes on, the pain is just like a needle going down through you, and you don't feel it here, you feel it here, but you actually get the relief here over the next couple of hours then. You know, because this one is for the neck and this one is for your arm.
Took it on a trip with those senior Gaelic football team to Lanzarote, used it on a couple of patients and found it quite effective, and then brought it back to use in the private clinic.
My brother is very skeptical. Tried it for something he had, and he said it was wonderful.
So they asked me how much it was. I said it was very reasonable. I said go buy it, and it's a good investment, and yes, I have recommended it.
So I think it's a great machine, powerful job.
So far I'm very happy, and more to the point, patients are very happy, and I haven't had anyone come back saying that they didn't want it. Everyone's come back with positive response, and always ask for another treatment.
While most people find Aculife helps with their ailments, it needs to be used regularly and in accordance with the instructions for the best chance of success.